Preconception care. There is an abundant prevalence of congenital anomalies. Example: neural tube defect is 107.5 per 10,000 live births in Ethiopia, and adverse pregnancy outcomes is 26.88%, including low birth weight, stillbirth, etc. Preconception care is a set of interventions that aims to identify and modify biomedical, behavioral, and social risks to improve pregnancy outcome during preconception and between pregnancy periods. It is evidence-based intervention that aims to optimize the health status of people of reproductive age before conception in order to reduce preventable adverse pregnancy outcomes. The objective is to minimize preventable maternal and perinatal deaths. By the time most women realize they are pregnant, usually 1 to 2 weeks after the first missed period, the embryo has already begun to form. Thus, many preventive steps, such as folic acid to avoid neural tube defects, will be ineffective if initiated at this time. Since most adverse pregnancy outcomes happen before the early periods of conception and the median antenatal attendance for Ethiopian women is around 16 weeks of gestation, investing solely in antenatal care is not adequate for improving pregnancy and birth outcomes. Ethiopia has also agreed to reduce maternal mortality from 401 to 279 per 100,000 live births, the stillbirth rate from 15 to 14 per 1,000 births, neonatal mortality from 33 to 21 per 1,000 live births, and under 5 mortality from 59 to 43 per 1,000 live births by 2025. Preconception care plays an important role in achieving these goals. In Ethiopia, there is a high number of maternal and prenatal deaths, and having a good utilization of preconception care decreased maternal and child mortality by 57% and maternal and child morbidity by 73%. Components of preconception care. Assessment. All reproductive age group couples, women should be asked for their reproductive life plan, pregnancy plan. Those who planned conception within the coming 3 months needs to be assessed for preconception care using assessment tool. Interventions. Preconception care intervention includes counseling, treatment, and linkage or referral. Preconception care interventions. 1. Nutrition. An underweight or overweight woman, a short woman, or women with micronutrient deficiencies during pregnancy contribute to increased complications for mother and fetus. Increased body mass index associated with pregnancy loss, stillbirth, diabetes, preeclampsia, congenital anomalies, shoulder dystocia, anesthetic complications, and wound infections and C.S. delivery. In Ethiopia, 22% of women of reproductive age are thin, 8% are overweight or obese, and 24% are anemic. Only 47% of women received adequate dietary diversity, and only 11% pregnant women took iron folic acid supplements for the recommended 90-plus days. A systematic review over 10 years reported that the prevalence of folate deficiency among women of reproductive age group in Ethiopia is as high as 46%. Ensuring dietary adequacy and healthy weight is essential during a woman's reproductive years and preconception period. Nutritional preconception interventions. 1. Nutritional counseling. It is recommended to choose at least 5 out of 10 different food groups at each meal and 6 different food groups throughout the day. 1. Counsel to consume 80-120 grams of legumes every day, such as beans, lentils, chickpeas, or peas. 1 medium ladle estimated to contain 100 gram up to 125 gram. 2. 100 up to 200 grams of various fruits and vegetables each day, such as tomatoes, kale, carrots, and papayas. Sad face. 1 medium-sized teaspoon cooked vegetable is 25-35 gram, or 1 glass homemade fruit juice. 3. Counsel to add 10 to 20 grams of nuts and oilseeds, such as ground nuts, sunflower, or sesame seeds, to your diet to diversify it. 4. Counsel to consume every day, include animal-sourced items in your meals, such as eggs, meat and dairy products. 1 glass of milk is 200 gram, 1 medium-sized egg is equivalent to 50 gram. 5. Counsel take up to 15-20 grams of fat and oils per day. Sad face. 1 teaspoon of oil equals to 10 gram. 6. Advice to drink 8-10 large glasses of clean water every day. 7. Advice to limit the intake of sugar, sweets, and soft drinks to below 30 grams per day. 1 teaspoon of sugar equals to 4 gram. 8. Advice to limit your salt intake to below 5 grams per day. 1 pinch of salt equals 2 gram. 9. Counsel to get some exercise every day for at least 30 minutes. 10. Avoid from consumption of unhealthy foods such as consumption of saturated fats, sugar-containing beverages, processed meats, and high sodium. 11. Advice: intake of calcium-rich foods such as dairy products, yogurt, milk, and cheese, eggs, fish, beans, soybeans, beef, and cereals like whole millet and rice. 12. Advice to take zinc-rich foods such as meat, fish, legumes, seeds, nuts, dairy, eggs, whole grains, and some vegetables. 13. Counseling on intake of iodine through use of iodized salt. 14. Promote regular consumption of fiber-rich foods which are essential for bowel movement, whole grains, fruits, vegetables. 15. Counsel on avoiding caffeine consumption, inhibitors of iron, zinc, calcium absorption, within 1 hour before or after eating, and promote increased intake of absorption enhancers like vitamin C-rich foods such as oranges, tangerines, mangoes, etc. 16. Counsel and educate on limiting consumption of processed, junk foods and other sugar-containing drinks to prevent overweight and chronic diseases. 1.1 Iodine supplementation. Iodine deficiency disorders can result in adverse maternal and fetal outcomes. Neurodevelopmental deficits in fetal brain are the most significant irreversible effect of iodine deficiency disorders during early pregnancy. In Ethiopia, studies showed that about 72.6% of schoolchildren and 80% of pregnant women had insufficient iodine intake. Ideally, women should consume 150 grams of iodine daily for a long period of time before conception in order to ensure adequate iodine supplies during pregnancy.